It's Mandy back with another video. Today, I want to focus on one of my favorite topics, and that is caregivers of those diagnosed with spectrum disorders. I think that other caregivers might benefit from this too, but I specifically want to focus on caregivers of this population, whether you have a young child, a child in their teen years, or a young adult, or a later adult. One of the things that you may not know about me is that in my background in working with kids that are diagnosed with autism spectrum disorders, oftentimes in the field in which I worked, it was a requirement for me to provide psychoeducation and to directly teach parents how to intervene with specifically behavior modification with their kids. When I started to work in outpatient in the past few years, I really started to embrace my energy psychology roots and apply those techniques with the caregivers of those diagnosed with autism spectrum disorders. So how this sort of unfolded was, people were coming to me with the intention that I would work with their child, but really, even from the lens in how I used to work, we needed to start with a parent and get a good idea of what type of behavior modification and what type of skills that the child had to be able to coach the parents and tweak their skills on that level. Then what I noticed is this energetic component, right? And this is where the stress compiles for you as the caregiver. And you've had overwhelming feelings if you're a parent out there, and the whole spectrum literally of feelings when you're working with your child. I think that's true for any parent, but they can be more intense when you have a child who has different needs, and especially kids that are diagnosed with autism spectrum disorders. As I said in other videos, these kids sometimes are really rule bound. Their brain is pretty predictable and consistent once you know the individual about what they expect, what they don't expect, how the rules go. And that, quite frankly, for a parent can get old sometimes and exhausting, right? If it's the same rule, the same thing, and you can't deviate, or some sort of anxious or frustrating behavior comes up, that can really set you off as a parent after a while over time, especially if you're confined or isolated to the home as we are now. So this is probably a newer experience at this intensity for a lot of you out there, unless you're homeschooling your child and acting as their behaviorist, which is really a lot. So today what I want to talk about is maybe some quick strategies for you as the parent or caregiver. I know that you don't have a lot of time. I know meditation is really, really tough. I've said that in other videos for anybody, let alone the pace that you have to go to maintain your child all day. And then just, okay, I have 2 minutes. Let me sort of quiet my mind and get into a meditative state. Probably not going to happen. So one of the things that you can do, and I have a video about this, it's called collarbone breathing. I think that this is an excellent way for you as caregivers to regroup and take a few minutes to breathe. But the intention of this exercise is not just any old breathing exercise. This breathing exercise, which came for the most part from the Callahan techniques, I might do it a little bit different than was suggested by Dr. Callahan back in the day, but it really helps to address and stimulate or deactivate, whichever, all parts of your brain, top, bottom, and left and right. We don't actually know why this works, but we suspect that it helps. The effect feels calming or energizing. Whatever your brain has too much of, it just sort of puts it in balance. So if you're too hyped up, for example, you might feel a little bit more relaxed after you do this. If you're too lethargic, it might give you a little bit literally of a breath of fresh air. So this is a pretty good technique to do. It's a little bit complicated. That's why I did it in the video, so you can just turn the video on. But this one I found for parents and caregivers really can give you a lot of bang for your buck. It's doing a couple different things rather than just taking some deep breaths. And I know even setting aside a few minutes can be difficult for you, but for some of the families that I've worked with, they will tell you that this can be life-changing alone, to be able to start to think and realize that I do need a few minutes for myself, and to actually take them without feeling bad. Remember, you have to put on your mask first, right? When you're in the airplane, put on your mask before you can help someone else. I hope that you reference that video, and I hope you find some comfort in it and you feel a little bit more balanced after you do the exercise. Hang in there. Thanks for watching.